Story 1. I was at a lecture a couple of years ago, performed by two doctors who had undergone treatment for breast cancer and written a book about it together. I remember her talking about her diagnosis. She was a breast cancer surgeon herself, you couldn't make it up. She walked into the room, saw her own scans with the doctor, and her heart dropped. She barely heard a word he said because she couldn't stop the flood of information she was getting. Looking at the scan, she knew if she'd need surgery, chemotherapy, radiotherapy, how long it would be, and what her estimated survival was. I don't think they discussed it like a group project, but I suppose she couldn't stop herself from listening to her own internal monologue since it was her own field. I remember her saying she'd found it, in hindsight, an incredible learning opportunity regarding how to interact with patients, and that she thought about it a lot. Story 2. It depends on what I'm going in for. As a background, I am an oncologist, so I have trained in internal medicine before. For most internal medicine type stuff, I do not bother going in unless I need something that I cannot easily get for myself, such as lab work or images. For specialty areas I was not trained in, I go in and try to give them the best history I can, but let them do their own thing. Story 3. I don't get involved in the management. I let the doctor seeing me lead that unless they miss something huge, and I would just double check. The main difference is I can present the whole history and relevant information in about 30 seconds flat, and the doctor, with that information, can just give me the management plan in about the same time. Fastest consultations ever. Very methodical. Story 4. Doctor here, neurologist. I'm not good at going to the doctor. I don't go often, but when I do, I usually just stay quiet, especially if it's a field of medicine I have no idea about, like dermatology. That being said, the doctor usually knows I'm a physician as well, and so the language tends to be more technical. I also find that we practice less defensively with each other since we can be more open. We could do multiple tests, but honestly, what you probably have is a different condition, so take this, and if it doesn't get better, then we can do further testing. Story 5. My mom is a general practitioner, and she usually just self-diagnoses most of the time, but will sometimes get a second opinion. She doesn't really go to another doctor, just calls them to ask about things. Her contacts are filled with all kinds of doctors. It's like a secret underground community. For things like getting ultrasounds, then yes, they do discuss matters as if it's a group project. Story 6. I hope you get some doctors in here to give personal answers. Paul Kalanithi did address this a bit in his book, When Breath Becomes Air. At first, in his cancer treatment, he was very involved in the decision-making, and the way he described the conversation with his oncologist was more like a collaboration. Later, she reminded him that he didn't have to participate in the decision-making and that he could just let her be the doctor and focus on himself. He ended up taking her up on this offer. So even between the same patient and doctor, the relationship varied. Story 7. I'm an emergency room doctor, and sometimes I have other doctors as patients. For the most part, they are pretty good patients because they can give a good description of their symptoms in a way that is useful to me. They usually ask good questions and are well equipped to have an informed discussion about their diagnosis and treatment. Sometimes it's hard for me to dial back my patient talk, where I simplify medical terms for laypeople. Sometimes it's challenging if their area of expertise is totally unrelated to the issue at hand, and they don't recognize their limited understanding. The worst patients are those who have just a little medical knowledge and think they know everything. Some version of, my aunt is a nurse, and she said I need a whole-body magnetic resonance imaging for this runny nose. As far as self-diagnosing, I usually deal with my own minor medical issues. If I notice signs of something more serious, I would go to someone else. Story 8. Doctor here, family medicine. I self-diagnose most things, but for my 1-year-old daughter, I decided a while ago that I don't want to do that for her. So her pediatrician doesn't know I'm a doctor. I never told her. I want her to treat me like any other parent and explain everything to me like I'm 5 years old. I'm afraid of being too nonchalant with my daughter's health that I'll miss something, or the doctor assuming I know more than I really do. It's actually a strategy I've adopted for myself. If I go to a doctor, say a gynecologist for a routine checkup, I sometimes just don't say what I do so I can legitimately ask dumb questions about things that I should really know, or so that the other doctor won't leave out important information that they assume I know for fear of insulting me. On the other hand, my regular doctors do know, such as the gynecologist who saw me through my pregnancies, and that enables more complex and nuanced discussions about health decisions. This involves debating questions and giving me options that he wouldn't necessarily do with other patients because he can be sure I understand the medical pros and cons well once I'm given a basic explanation. Story 9. Doctor here. It is a bit dependent on the field of medicine involved. For example, I don't know much about neurological issues, so if I went to see a neurologist, I certainly wouldn't be contributing. For more generic conditions, I have previously offered my thoughts to my doctor about what it could be. Ultimately, I still go to the doctor as they can prescribe drugs or order tests for me that would be difficult or questionable for me to do myself. Story 10. Doctor here. In general, we are not good about going to the doctor. For me, it's physicals about half as often as recommended, and that time I had strep a year and a half ago that didn't resolve with whatever antibiotics I had in my medicine cabinet. When we do go in, it is like a group project. We usually hash things out together, but ultimately I am going to defer to someone with more expertise than me in that area who can make an objective decision. Story 11. I was sitting in a consultation between two doctors, with one needing an ultrasound. They knew each other through work already, so it was very friendly and casual between the two of them. The patient doctor was trying to figure out what was going on with the ultrasound screen, and the other doctor was teaching him the parts he didn't know. Story 12. The pace and density of the conversations are different, I'm sure. I'm an emergency physician who has, over time, treated various physicians in my community, including internists, surgeons, and radiation oncologists, some from my hospital and some not. Keep in mind that each specialty is quite different from the others. The radiation oncologist, for example, thinks and speaks differently than the orthopedic surgeon, and I felt like my treatment of each of them was really quite similar to treating a professor of engineering. Academically minded people tend to ask lots of questions and research information while you're out of the room, as compared to populations that request a more paternalistic approach and just want you to tell them what to do so they can get on with their day. I'm careful to acknowledge that the number of hours that went into my family physician's training is the same as mine, simply on a different topic. She knows a lot about management and screening for chronic disease that I don't, and I know how to intubate people, manage a bad lysergic acid diethylamide trip, or use a jar of bubbles to distinguish between kids that are scared and kids that are head injured. Story 13. I always go to someone who doesn't know me, and I wouldn't say that I'm a doctor as well. On the other hand, my significant other is a doctor too, and whenever we feel something, we discuss it like a group project in which he always refuses any treatment until his symptoms get to the very worst. Story 14. Both my parents are doctors, and they see each other as their doctors. For their situation, they don't make appointments for anything. So if I or they get the flu, they just write a prescription. If they need specialists, they usually tell them they are doctors and they receive better treatment like skipping lines or whatever. Or they know each other already, so it's calm. I'm sorry if this sounds spoiled, but it's my experience. Story 15. Obligatory not a doctor, but spouse of a doctor. I thought I might have a ganglion cyst in my wrist because I could feel something inside that was causing pain when I moved my wrist, so I scheduled an appointment with an orthopedic surgeon and hand specialist. I had my husband come along, an interventional radiologist, in case there were questions I wouldn't have thought of asking or something I needed more explanation on later. The orthopedic and hand surgeon was friendly and used layman terms with me but technical jargon with my husband. It was funny to hear the switch between your wrist bones and tendons and blah blah anterior blah blah medial blah. Whatever he said to my husband. At one point, they did an ultrasound on my wrist to determine if it might be a cyst or if I should get a more detailed magnetic resonance imaging scan, and the surgeon asked my husband if he wanted to take over the ultrasound since my husband trained in diagnostic radiology as well, and he totally did. Weird to have your husband moving the ultrasound wand and pointing to random blobs of static. They both agreed it was a cyst, even though it looked like a whole lot of static and nothingness to me. So it was interesting to see my husband defer to the surgeon for his specialty and vice versa. Edit. Just remembered that time we took our cat in for an x-ray because she was developing arthritis, and we weren't sure how severe it was or if her bones were deteriorating. My husband actually took her x-ray in and had an attending in radiology read it, and they were both convinced our cat had bone spurs or little bone growths around her spine near her hip. He was about 80% convinced that our cat's spine was absolutely wrecked. The vet wasn't worried and said that cat bones just look like that and it wasn't hurting her and was nothing to worry about. He ended up doing some research on feline anatomy to make sure our very knowledgeable vet wasn't just talking out of her. She wasn't. Anyway, moral of the story is that he went to medical school to study human anatomy, not feline anatomy, so he had to learn to take a step back and defer to the expert. Story 16. I try to act like any other patient. Medical professionals can sabotage their own care by taking shortcuts or declining to approach their own problems the way other patients do. It's a mistake. I have seen harm done that way. I don't come in for trivial things like self-limiting infections or things that are harmless because I know that they are. But I do see my regular doctor for problems that really bother me or for routine exams like anyone else. It can be stressful to be the doctor or the patient in this kind of interaction. I've learned not to let it bother me when I am the doctor seeing other doctors. It can be harmful to the doctor as a patient if you let that kind of interaction get to you. I try not to generate stress for other doctors who see me and know what I am. That could be detrimental to me. Story 17. My grandpa was a cardiologist, and he is the worst at knowing when to go to the doctor. As he got older, he would get cardiac arrhythmia but keep saying that everything is fine and he does not need to get checked. Story 18. My mom is a nurse and never tells the doctors what she does for a living. It's so they'll speak to her not as a nurse, but as a patient. Even though she can understand what they're saying when they use their medical jargon, she doesn't want them to be overly comfortable using the jargon while treating her. Story 19. As an emergency room doctor, when I go to my primary care physician, all decisions are made in tandem, and I do have more input on my treatment plan than a layperson. But I second what others have said. When I'm seeing another physician, like a specialist, I am more capable of making informed decisions than a layperson but will always defer to their experience and knowledge. 2 examples. 1. I had a primary care physician who said jokingly to a medical student in front of me, "How could he even sue me? He's a doctor." I promptly found a new primary care physician. It's okay to not like a doctor. Even doctors dislike other doctors. I'm a doctor with literally tens of thousands of hours of experience and knowledge saving people's lives. And even I know that I don't know 0.1% of what Anthony Fauci knows. Wear your mask. It's not a debate doctors are having, just uninformed people. Story 20. Had a relative who was an old-fashioned veterinarian and probably the worst patient because of it. This guy would argue with his doctors about his prescriptions and then order the medications through the veterinarian pharmacy because they were significantly cheaper, which makes sense, I guess. Why pay $50 for a particular medication when he can source the exact same thing for $5? But still, it looked kind of funny when he was in his 80s hobbling around with heart medications that had for dogs only in big print on the bottle. Edit. Clarify veterinarian. Story 21. Doctor here. Like someone else said, if I'm seeing a specialist in a particular field, then I'm unlikely to have anywhere near as much knowledge as them, so I would consult with them just like any other patient. If it's something more general and I'm seeing a general practitioner, for example, I will tell them I'm a doctor so that they don't go into lengthy layman's explanations, but generally I will try to have a normal doctor-patient relationship. I might offer an opinion on what I think, but ultimately, I try to stay quiet and respect that they are a professional and not tell them how to do their job. It's hard to be objective, too, when the patient is yourself or a family member. Having someone give their unbiased opinion is often more useful than self-diagnosing, or at least might add some more knowledge or insight that you may not have yourself. Story 22. Greatest doctor call of all time. First paramedic here, not doctor. Call for chest pain side of the road. A guy pulled over to call 911, not local, just passing through. While my basic is applying leads, I'm getting some history. The guy is obviously well-educated, knows his stuff, and just speaks the lingo. I run a 12-lead electrocardiogram. It's bad. Not catastrophic. Just a let's get the catheterization lab wound up and drive really fast. It's also a little odd, so I decide to flip it 15 lead, flip it again, do a right side. The whole time we are making tracks to the emergency room. The guy asks about nitroglycerin, and I start explaining that certain types of heart attacks can be made much worse with it. He asks to see his strips, so I humor him and hand them over while I'm calling in my report. He thanks me, says I'm right, it's anterior, etc., and he's going to need a coronary artery bypass, etc. Freaking cardiologist. coolest, most laid-back patient ever, having a freaking heart attack and starts explaining to me about the surgical process he's about to undergo.